Conversation with the DNP. My name is Darius Fields, and for this conversation, I spoke with Marquita Morris DNP. She graduated from ECU in the class of 2020 and has been practicing as a DNP ever since. When I asked Marquita why she got into healthcare initially, she expressed that she was a senior in high school, and during that time, her senior project was to shadow a nurse. It was at this moment that she decided that she fell in love with healthcare and that it was a career path that she wanted to pursue. She decided on getting her DNP after working as a nurse for over 10 years. During this time, she obtained her LPN, RN, and eventually her BSN. When it came time to decide what kind of nurse practitioner she wanted to be, she just chose the DNP pathway because the FNP role was being taken out of some schools' curriculum, as there was a push at that time to move towards DNP being the preparation of nurse practitioners. She felt like even if things were to change at a later date, that she would be future-proofed by having her DNP sooner rather than later. Currently, she works as a FNP at Atrium Health in Charlotte, North Carolina. She works in an underserved clinic in the inner city where she takes care of patients who may not have a job, vehicle, or health insurance. By taking care of these patients, they receive care from her that they most likely would not receive otherwise without such a clinic existing. In a typical day, she arrives in the office and reviews her charts. She has a schedule already set out for the day, and she reviews each patient's caseload and decides what will be most likely needed for that patient's complaint. Considering that some complaints are more complex than others, she has colleagues in the facility that she can speak with and deliberate on what other methods she can use to treat those patients. As those patients arrive, she does her thorough examination and decides what course of action will be best needed for that patient's care. She then provides whatever treatments may be needed in the clinic and prescribes the additional medications that may be needed for the patient to continue their care at home. Depending on what the patient needs, she will reschedule that patient to come back in a prescribed amount of time so that she can follow up on whatever findings she had from that day. I also asked Marquita what she would have done differently considering the path that she's in now and knowing that hindsight is 2020. Marquita told me that she would most likely consider becoming a physician rather than going into school to be a nurse. She felt like being a nurse for 10 years and becoming an FNP 2 years ago, she spent the same amount of time that she would have in school becoming a provider anyway, and that by now she would be a more seasoned physician and that she would be able to have full authority to open a clinic of her own if she wants to. As a nurse practitioner in the state of North Carolina, we do not have full practice authority, and that she's limited to having a supervising physician wherever she is. And that's regardless of whether the physician is on site or if that physician is remote and just looks at charts periodically. Either way, she has to have a supervising physician, and that's a limitation that she's not sure she would want to voluntarily take on if she could start over. Looking to the future, I asked Marquita what's next for her. And she explained that she wants to get into real estate, as that's something that may carry over into the future, and it gives her something that her children may be interested in as well later on. She also expresses that she's looked into some educational pursuits as she's currently working with Thrive, which is a course, online school that allows her to give supplemental education to advanced care providers, whether they be nurse practitioners or physician's assistants. She's also looking into possible administrative roles, knowing that as a DNP, she can also help run a hospital or an organization depending on what the needs are of that facility. So who knows what the future may hold for Marquita. Either way, her future is really bright. It was great talking with Marquita, and I appreciate her taking the time to have this conversation with the DNP. Thank you.